ASHA workers. You've seen a lot of this. You're also in the field of education, so you know the work that Raju Kendre is doing is going to define lives, and thousands of them. So who would you pick?
So my natural choice are the ASHA workers, because it's not about just one story. It is about a million stories emerging from different states and different districts of India. And we are here talking about social change in a country that's as huge as India. When we look at ASHA, the irony is it becomes like a faceless, somebody said it's an organization. No, this is not an organization. It's a story of over 9 lakh women community health workers who are toiling day and night to provide you health care, to provide you nutrition services, to provide you basic sanitation and hygiene, to take the pregnant mother to the hospital. And when we talk about COVID-19 pandemic, where so many of us were, even hesitant to meet our own family members for the risk of contracting the infection, these ASHA workers who get paid less than 8 to 9,000 rupees a month were going house to house, almost serving 25 households each day. Each of these ASHA workers going house to house, telling people about why COVID is dangerous, how to protect yourself from COVID, how to wear your mask. They've distributed masks, they've distributed sanitary napkins, they've distributed food rations. They have literally prevented people from falling into, the ruts of poverty and food insecurity, and of course have mitigated the public health.
Yeah.
And most recently, the entire vaccination drive, it's not a doing of one person or one woman, it's the doing of, this million-strong army of ASHA workers that we have. And I feel that, it's when we say that, here where we are giving awards for social change, awarding it to an individual who has a face, who has a name, makes more relevance. I would say that the reverse is also true. For a group like ASHA workers who will not, today come into the studio and sit and talk to you and tell them their stories, I think it's even more important to recognize the unrecognized work that these ASHA workers do. And this is just COVID. You talk about who takes a pregnant mother in a village community to the primary health center? Who takes a child in India to, get their immunization shots? Who's the first point of contact in a community when communities learn how to do hand washing? So these are basics for health, for nutrition security, for sanitation and hygiene. And that is what really contributes to human development. That is what contributes to, social change at a scale that is really palpable in a country like India. And I would say that we really need a million stories of change. And when we recognize a group like ASHA workers, you're not just giving them an award, but I think it's also an opportunity to really ask ourselves as a society in terms of how do we really value care work that is done in India. Do we just take them as granted because, women are imagined to be caregivers? These women do not have minimum wages. They make a paltry sum of 5 to 6, 7,000 rupees a month. Do we take that for granted and imagine that, yes, it's just a part of public health system. They are sarkari, honorary workers who will anyway work. Or do we really, as a society,
appreciate them?
Such awards as a way to bring forth the actual work
You make a
that
very
they are
strong
doing.
case, Ananya.
Because I'm sure a lot of Indians really...
You make a very strong case, and that's why somewhere
sure
there is a conflict. And very rightly so. And that's why there is a conflict between the head and the heart. The head says that you have to go with these 9 lakh, grouping of 9 lakh workers, unsung. So Kasturiji tells us that she learnt about the ASHA workers today. She read about them, and but the fact is that they are the backbone of our primary rural healthcare and education. And the fact is that they are doing so much more. These agents of change are the real agents of change. The heart says just